Then diffuse esophageal spasm, uncoordinated movement um, occurs here in esophagus. Diffuse esophageal spasm, uncoordinated movements occur here. Investigation of choice here is manometry. The esophagia appears as a corkscrew, so corkscrew appearance of esophagus. Here, Shatatsky ring formed at esophageal gastroesophageal junction. There's a ring formed at gastroesophageal junction, which is called as Shatatsky ring. Okay. Then now, all of our favorite topic, GARD. It is most common in males. Okay. Then angina like pain occurs. Acid brash or water brash means it comes. Okay. Then asthma, nocturnal coughing. Asthma may occur. Nocturnal coughing here in GERD. Sinusitis may occur. Laryngitis may occur. First investigation is endoscopy, in which we can see velvety appearance of lower esophageal sphincter. Okay. Alias tones decreases. Here alias relax. That's why LES, lower esophageal sphincter, means the sphincter between esophagus and stomach. It is relaxed, so the 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 food which is present in the stomach can again and again come in esophagus because the sphincter is relaxed. It is not constricted, or its tonicity is not high. Its tonicity is less, decreasing. Most sensitive test is 24-hour gastric pH monitoring, but we don't do that. We do endoscopy. Velvety appearance of LES, where we see salmon pink appearance of uh, you know in Barrett's esophagus. Salmon pink epithelium. Okay, epithelium is salmon pink, and here velvety appearance of LES. Okay, most sensitive test is 24-hour gastric pH monitoring, but it is not done. Treatment is PPI and lifestyle changes. Complications in GRD are Barrett's esophagus, which causes adenocarcinoma, then iron deficiency anemia in males, and asthma may occur. Then Zenker's diverticulum, pharyngeal muscles herniate. Here, pharyngeal muscles herniate through Callahan's dehiscence, which is a weak area between two parts of inferior constrictor muscles between thyropharyngeus and inferior cricothyroid cricopharyngeus inferior cricopharyngeus. Okay, pharyngeal mucosa herniates. Pharyngeal mucosa goes below, herniates inside Callahan's dehiscence. Okay, it goes there. So clinical features are like it is acquired disease, not congenital. Obviously, it herniates. Okay, it is seen in mostly more than 60 years of age people and older age group, and dysphagia may occur. Gurgling sound is the key point here. Gurgling's key term here. Gurgling sound while swallowing occurs. Gargling, gurgling. Okay, halitosis may occur, cough or pneumonia because of the food goes there. That's why. Treatment is surgery. Then short bowel syndrome. Here, resection of small intestine. It's a triad of three things. Short bowel syndrome, resection of small intestine, diarrhea occurs, steatorrhea occur. Here, increased renal calcium oxalates calculi because of resection of part of small intestine. Okay, oxalates, out of negative feedback, oxalate increase more. Oxalates absorption increases, so oxalate rich food like Spanish is avoided here. Okay, calculi, increased renal calcium oxalates calculi, then due to that gallstone occurs. Okay, diarrhea and steatorrhea. Then vitamin deficiency, ADE, is more here. Here we are in these GIT diseases, because K is synthesized in body, so it does not have any more effect on GI diseases. um, Ileum, if we have read this, ileum is resected, then vitamin B12 is deficiency may occur, because um, more vitamin B12 deficiency occurs more than fat solubles, and if jejunum is resected, then fat soluble vitamins deficiency may occur, especially A, D, E, not K, because it is synthesized in body only. Then irritable bowel syndrome is visceral hypersensitivity, especially to stress, lactose, and fructose. Irritable bowel syndrome, which occurs before giving exam or anything you have given, it is common in young females. Means I have gone through it because of exam. I have some irregular bowel, and then because of stress, and I don't like to drink milk at that time. So because due to stress, because of exam fear and all, lactose, fructose. Okay. Then abnormal stool frequency occur. Diagnosis through abnormal stool frequency, abnormal stool consistency, abnormal stool habits. Okay, anytime we are going. Okay, then abdominal pain, which is improvised with defecation. It improves the abdominal pain improves with defecation. Okay, treatment cornerstone of therapy is psychotherapy. Means we have to relax, we have to calm down, we have to, it is not the end of the world, or it is not the end of our life. Okay, so just chill. Diagnostic criteria: abdominal discomfort for 3 days and change bowel habits for at least 3 months. Abdominal discomfort for 3 days. Abdominal discomfort started 3 days back, but change bowel movement habit for at least 3 months back. Okay. Infused Jaeger syndrome. Okay, this is a triad of 3 things. Pigmentation, mucocutaneous pigmentation like cafe or lot spots. Then GI polyps, more common in small intestine than large intestine than stomach. It is autosomal dominant. Please remember this. It is autosomal dominant. Then neoplasm may occur of non-GIT organs like breast and ovary. Hematomas may also occur. Okay, then Zollinger-Ellison syndrome. Here, gastrin release is very, very high. Gastrin is released by G cells. Gastrin is released by G cells. G cells secrete high gastrin. Okay, due to which high acidic environment and H plus ions. Increased gastric acid is there. Increase amount. Increase due to which increased amount of peptic ulcers occur at unusual sites. At unusual site is the key term. Then VITT means vaccine-induced thrombocytopenic thrombosis at splanchnic circulation, unusual sites. It can also occur. In clinical features, due to vaccine, ulcers may occur here. The clinical features: recurrent ulcers, resistant to treatment, unusual sites. Clinical features are recurrent ulcer. Recurrent ulcers are occurring because of increased gastric acid, then resistant to treatment. Treatment say resistant, then third point is unusual sites. Okay. Diagnosis is increased BAO, basal acid output is increased. The ratio of basal acid output to maximal acid output is increased. Okay. Most sensitive and specific test for diagnosis is gastric provocative test. Gastric provocative test by the use of secretin. By the use of secretin enzyme, we do gastric provocative test in Zollinger-Ellison disease syndrome. Calcium infusion test we can also do. Meal test we can also do. Increase fasting gastrin we can also do. Treatment is PPIs. Then lipoma. In insulinoma, investigation of choice gold standard is 72-hour fasting insulin test. Okay. Then vipoma. Vipoma is Werner Morrison syndrome, Werner Morrison syndrome, or WDHA syndrome, also called as pancreatic cholera. Okay, here delta cells produce VIP, vasoactive intestinal peptide. Delta cells produce vasoactive intestinal peptide, which is a neurotransmitter. Vasoactive intestinal peptide, which is a neurotransmitter, which decreases acid production, increases smooth muscle contractility, increases small intestine, increases chlorine secretion in small intestine. Okay, WDHA. Watery diarrhea. Watery, D for diarrhea, H for hypokalemia, and A for achlorhydria. Chlorine is absent. Okay. Then Clostridium deficit infection. Clostridium deficit infection, it happens after use of antibiotics, especially broad spectrum antibiotics. Okay, treatment is the antibiotic of choice is vancomycin. Then inflammatory bowel disease, this is very important. Crohn's disease and ulcerative colitis. Okay, first we see Crohn's disease. It is more common in males. Crohn's, males. Okay, first site is rectum is spared, except rectum. Ileum, rectum is spared. It can occur in any intestine. Okay, not any, but yeah, rectum is spared. It can occur. Most common site means small intestine and large intestine except rectum. Most common is ileum. Okay, and then sisters is the abbreviation is to remember, it's a mnemonic. S for skip lesion means skip lesion. Lesions are like this, skipped lesions. Okay, not continuous. Skip lesion. Then most common site is ileum. I for ileum. S for ASK antibodies is more common here. Then then T for transmural. All transmural means all layers are involved here. All layers of small intestine, all layers of GIT is involved. Small intestine, large intestine. E for excess fat is there. Okay. R for rectum is spared. S for string sign for of Cantor. String sign of Cantor. Okay. So in X-ray, hose pipe appearance is seen in small intestine, and fissures and fistulas are also seen not on an X-ray, but on endoscopy. Like, then first ulcer is aphthous ulcer here. Okay, then serpentine ulcer, like this around this. Serpentine ulcer form later, and first ulcer is aphthous ulcer. Okay, it gives cobblestone appearance of ulcers. Okay, sulfas. Okay. Okay. Then ulcerative colitis, most common site here. Treatment of Crohn's disease is steroids. Okay, just steroids. Then ulcerative colitis, most common site is rectum. In Crohn's disease, rectum is spared. In ulcerative colitis, most common site is rectum. It is pancolitis, means it is continuous lesion. Okay, then it is made up of 3 A's. AAA, arthritis may occur, ankylosing spondylitis may occur, anterior uveitis may occur. Third, backwash ileitis. Backwash ileitis means can go with large intestine. Then ENCA is more positive than ESCA. Here ESCA was more positive. Okay, antibodies, also anti-goblet and anticolon antibodies are also present, but ENCA is the more positive antibody here. Then large broad ulcer, here no skip lesions, here large broad pancreatitis ulcer. Then 6 fistula and fissures are less or not present. Okay, Then pseudo polyps may occur. Ulcer, this is ulcer, and here growth, pseudo polyps growth occur, and this is, large broad ulcer. Then toxic megacolon. Toxic megacolon here, the yeah, the colon is toxic and it is mega, large. Okay. Ganglion layer is affected. Severe form of ulcerative colitis. Okay. If ganglion layer is affected, then it is a severe form of ulcerative colitis. Only submucosa and mucosa are affected. And in Crohn's disease, it is transmural. All layers are affected. Here, only submucosa and mucosa layers are affected. Okay. But serosa and muscularis mucosa are spared. Okay. Then now this a difference between these two, Crohn's disease and ulcerative colitis. Okay. Skip lesion is present in Crohn's disease. Okay. Here it is pancreatitis continuous. Then cobblestone present in Crohn's disease. CC. Fistula fissures present in fibrosis. FFF present in Crohn's disease, not in here. And pseudopolyps present in here. Pseudopolyps. Okay, growth, large growth. Sites. Here, ileum is the most common site with the rectum sparing. Here, most common rectum. Then layers involved, transmural, all layers are involved. Submucosal and mucosal layers are involved. Then toxic megacolon, here present, not present. X-ray, house pipe or cobblestone appearance, here lead pipe. Lead pipe. Then sex, most common in males, here equal gender predilection. Smoking, yes, smoking is the main point. Crohn's disease, smoking causes Crohn's disease, but smoking prevents ulcerative colitis. Ulcerative colitis is prevented by smoking. Means the patients of ulcerative colitis should smoke, cigarettes. OCP, oral contraceptives, increased risk, no effect. Then appendectomy, increased risk, may be a protective here. Every bad thing is protecting ulcerative colitis. Malignancy, here present, here more common. Then malignancy is more common in ulcerative colitis. Blood disorders, here no effect, here present. So due to that, in stools, bloody stool may occur hematuria or no. Pain abdomen, here more common, here less common. Okay, that's it. We are done with GIT medicine. Thank you.